Hello, today I'll be assessing cervical flexion and extension manual muscle test. So you can have your patient in the supine position for cervical flexion manual muscle test. The agonist muscles that we'll be assessing are the scalenes and then the deep flexor muscles of the neck. So Matthew, the movement you're going to be performing is cervical flexion or taking your chin to your chest here, okay?
Mm-hmm.
So go ahead and perform that movement by yourself for me. Good, excellent, good. So my stabilizing hand is going to be here underneath his head, just solely for patient safety and support, so that they don't hit their head on a table. And then my force hand is going to be applying a downward force into the forehead. So Matthew, go ahead and perform that movement again. Good, I'm going to support you here, and then just hold here for me, okay?
Mm-hmm.
Good, and hold, 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 and relax. Next, I will be assessing cervical extension manual muscle test. So you can have your patient in the prone position. And the muscles that we will be assessing are splenius capitis and splenius cervicis. So the motion you're going to have your patient perform, Matthew, is going to be here for cervical extension, taking the back of your head and lifting it up or chin off of the table for me. Okay, so go ahead and perform that for me. Good, excellent, and relax. Good. So my force hand is going to be here on the occiput, and then my stabilizing hand is going to be here on the forehead. Again, just purposes for patient safety and just support. So Matthew, go ahead and perform that movement again. Good. So I'm going to support you here on your forehead and then apply a downward force here. Okay, you ready?
Mm-hmm.
Good. And hold, 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 and relax. Next, I'll be assessing cervical flexion, active range of motion with a goniometer. So patient position, you can have your patient short-seated or in a chair here, and then just kind of cue your patient to have good upright posture for me. Good, excellent. Good. And then, so the axis of the goniometer is going to be on the external auditory meatus here on the ear. And then your stationary arm is going to be perpendicular with the floor or pointing upwards, just so that it doesn't get in the way here of the shoulder. Good. And then your moving arm is going to be following the base of the nose or the nares of the nose, the base of the nares. So the motion you're going to be performing, Matthew, is cervical flexion or taking chin to chest here, okay?
Mm-hmm.
All right. When you're ready, go ahead and perform that for me. Good, and relax. Good, so he got 0 to 42 degrees, and normal is 0 to 45 degrees. Next, I will be assessing cervical lateral flexion or side bending with the goniometer. Patient position, you can have your patient short-seated, and once again, just cueing them to have a good upright posture here. Good. And then your axis for your goniometer is going to be here on C7. And then your stationary arm is going to be along the spine or following the spine. And then your moving arm will be following about the midpoint of the head here. So again, we're going to be assessing cervical lateral flexion. So Matthew, that motion here is going to look like bending here and then bending this way. Okay, mm-hmm. So we'll go to your left first, we'll assess, and then we'll assess to your right, okay?
Good.
All right. Get you lined up here. Good, and then when you're ready, go ahead and go to the left for me. Good. We've got about 0 to 26 degrees. Okay, go back to center for me. Good, and then to the right. Good, and got about 44 degrees there. So his left was 0 to 26 degrees of cervical lateral flexion, and his right was 0 to 44 degrees of cervical lateral flexion, and normal is 0 to 45 degrees.